Hi, everyone. Welcome. So again, today we're going to talk about tips for starting your breastfed baby in childcare, some strategies and what to expect. So my name is Lauren. I am also a certified lactation counselor. And then I have two kiddos. I have a 7-year-old and a 3-year-old, and I breastfed both. It was not a smooth ride breastfeeding either of them. So I can help navigate some of the struggles that do arise when it comes to breastfeeding. They also both went to childcare full-time as infants, so I understand what that transition looks like, how that transition might change as your baby gets older or turns into a toddler, and kind of what to expect in the childcare process. So Childcare Answers is super active on social media. So if you do not already follow us on Facebook, YouTube, Twitter, and Instagram. All of our webinars we record and put on YouTube, so you can always revisit those and check those out. So Childcare Answers is part of a larger network of resource and referral agencies. Our agency is housed in Marion County and handles Marion, Hendricks, and Hamilton counties. But even if you are outside of our 3 counties, we're here to support you and refer you on to your specific agency. We all work hand in hand, so it's a seamless transition. So even if you fill out our family info form or email me for questions and I need to refer you on, it's a very seamless process that you won't even probably know that you're being passed along. And we all communicate and share. So a plan for today, kind of a breakdown. We're only here for 30 minutes, so it's a quick and easy in and out webinar. I really want to kind of go over how to choose a childcare program that's going to support you in breastfeeding, because I think that comes number one. That as we talk about this transition and strategies during the transition of sending your baby off to childcare, if you don't have a provider that supports your desire to breastfeed and understands the complexity of a breastfed baby, then you're kind of starting off on the wrong foot, and you're starting off probably in an area where you're not going to be successful and not going to reach your own individual goals. So I think that comes first, and that is something that myself, as well as all of the other resource and referral agencies, can help you with, is by helping connect you to programs that accept infants and that support breastfeeding in the program. I also want to talk about preparing for the transition. So if you're home with baby during maternity leave, if you're pregnant, if your baby is maybe with grandma or they're home with you, or maybe you have a toddler who's breastfeeding and you haven't yet sent them off to childcare, how do you prepare for that transition? What are some things that you can do before baby's first day of school that can really help ease those issues that might arise, your nerves, make it just kind of as smooth as possible. Also, I think it's important, as we're talking about sending baby off to school, is to understand your supply and baby's needs, because you're going to be putting milk in bottles and you're used to feeding baby at the breast. So how much does baby need? How much does baby take? How often should baby be eating? Are all things that we're going to talk about, as well as reviewing storage guidelines. Because now you have pumped milk, and what do you do with it, and how do you store it, and how do you transport that milk to childcare, as well as anticipating any possible challenges that might arise. So first and foremost, I think it's important to talk about choosing a childcare program. So one of the things that the resource and referral agencies can do is provide you a list of childcare programs that accept infants, that work off of the hours that you are needing care, that's close to home or work, and that really supports your desires and goals as a parent. As you're navigating, looking for care and trying to weed down that search, so we'll provide you a list of programs, but then it's up to the parent to really decide, is this the program that's right for me? Would my child feel safe and comfortable here? So as you're weeding down that list and trying to find the right program for you, you can inquire about their breastfeeding policies and procedures, and if they've had any training around supporting the breastfed baby or trainings around breast milk in general. There are trainings available to childcare providers both in the state of Indiana as well as nationally. So that is also something that I can share with you to pass along to your prospective child care provider, or I can refer them off to our partner agency who can also come in and offer some assistance and guidance around that as well. But first asking, have you even had training in breastfeeding? What is your expertise in breastfeeding? You want to ask them about extended breastfeeding and their comfort level and support around toddlers who breastfeed, if that is your goal. So if you are planning on breastfeeding past the infant stage and into the toddler years, which is 100% your choice, it's important to have that conversation right off the bat, because you may have an infant classroom that is super, super supportive and knows what to do when it comes to breast milk, but then the toddler teachers may not be equipped with what to do. So that may be a conversation that you want to have right off the bat instead of finding out that that is a challenge a year down the road. You also want to ask them if they have space to feed on site. So where can I feed on site? You may be comfortable feeding inside of the infant space. You may want a different space. That's completely up to you. So asking what your options are around there. Just know that you should be welcome in any program to go in whenever you want and feed your baby. Obviously, COVID impacts some of that right now, but a program should have an open door policy, especially for a breastfeeding mom to be able to go in. So if the program seems super supportive of breastfeeding and breast milk, but they're not willing to have you come in and feed on site, and that's something that you're desiring to do, then that may not be the best program for you. And when it comes to feeding, if you're hoping to go on your lunch break, to hop over and feed your baby, it may be better to find a program closer to work than closer to home. And home and work may be the same place right now. So that may be part of what you consider when you're looking for a program that supports breastfeeding in your baby. So here are some common questions that you can ask as you're interviewing teachers and staff, as you're talking to the director about what you're looking for and what your goals are around breastfeeding. So first and foremost, you want to ask how staff warm milk. So what does that look like? You really don't want them warming in a microwave or a crock pot, because it can get too warm and kill the microbodies and microorganisms within the breast milk. Excuse me. So what you're really wanting is for them to warm it under running warm water or in a bottle warmer. You also want to ask if there are certain labels or ways that you need to label your breast milk, because this is something you can also do and prepare for ahead of time, is knowing what the label should look like and how to label milk. In all types of care settings, bottles of milk need to be labeled so that a teacher knows if this is your child's milk or somebody else's milk. It's also important that they know when the bottle was prepared and how much is inside of that bottle. You also want to ask questions on time limit of disposing of unused milk and what their policies and procedures are around that. If the program is licensed or registered, they are required by state licensing to dispose of milk after an hour, and that's from the time that the baby drank from that bottle. But this is still a conversation because it's possible for breast milk to get a doctor's note to increase the time that that milk is good for. There's also the opportunity to maybe have that milk come home at the end of the day to use in baby's bath, especially if baby has eczema or dry skin. So there are ways to kind of reuse that milk without baby drinking that milk. You also want to keep in mind that because milk has to be disposed of after an hour, you may want to try smaller bottles to start with so that that milk isn't being wasted. You also want to ask questions around frozen breast milk if this is something that you're thinking about doing. If you're pumping just for the next day and you never have any in the freezer, then this may not be a concern to you. But if you are planning on bringing in bags of frozen breast milk, you want to ask about their ability to store those bags. So a lot of childcare classrooms will have a mini fridge with just like the little tiny freezer compartment inside of the mini fridge. Milk in that refrigerator or freezer section in the refrigerator is only good for about 2 weeks. So that is something to keep in mind. If they're using frozen breast milk every day, probably not a big concern. But if you are supplying a couple bags of frozen breast milk for kind of those what if occasions, then seeing if they have an additional place to store it, like a deep freeze. You also want to have a conversation around the backup plan if for some reason there isn't enough milk for your baby, in case you're running late or something happens. You never want to make the assumption that they know what to do, that they know to call you, that they know to pull out that bag of frozen breast milk in the deep freeze. You want to never assume that they know the answer to what you're wanting for your baby. So always have that conversation up front. And then again, seeing if it's possible for you to feed your baby on site. And the answer should always be yes to that question. So now that you have narrowed down your childcare search, you are planning that transition to go back to work or send your baby off to childcare. How do you prepare for that transition? Number one is practicing pumping. Because you're going to need to pump when away from your baby to continue to have milk available for baby, you want to make sure that the first day you're separated from baby isn't the first day that you're pumping. This doesn't mean that you have to pump often or a lot. It's just getting used to what the pump feels like and how to pump. You also want to make sure that baby is introduced to a bottle before their first day of school. My old role was infant toddler specialist to childcare programs. And one of the things that I did a lot and loved very, very much was going into childcare programs to help that baby take a bottle if they were struggling with a breastfed baby kind of accepting a bottle and wanting to drink milk from that bottle. There are a lot of strategies that we can try if your baby is not wanting to take a bottle, but first just introduce it and then we can navigate those challenges after. You also want to ensure that you have all necessary supplies. So like a cooler or freezer bag, bags for pumping, extra bottles, labels, ice packs, whatever you think you may need for that transition. Additionally, you want to define your own goals and expectations around breastfeeding so that you can ensure that you're doing everything you can to meet your own personal goals. I did not meet my breastfeeding goals with either of my kids. Things happen. Breastfeeding isn't always easy peasy lemon squeezy. I put the baby to the breast, they breastfeeded, they're good. When we're separated, I pump and I get all of this milk. It doesn't always look like that. So first define what are your goals. What am I expecting of breastfeeding now that I'm going back to work and my baby's going to childcare? And then navigate any hiccups along the road if they arise. But first establish what you're even wanting in the process in the first place. And then have some extra milk on hand. And I underlined some because you don't have to have a freezer stash of hundreds and hundreds of ounces of milk. You only really need milk for the next day. So be very aware that you don't need all of this milk and that expectation that may have been placed on you from society to have this entire freezer stash may not be the most appropriate expectation. So have some milk, but you don't have to have a ton of milk. So as you're practicing pumping, I would begin with starting just a couple of weeks before returning to work. You don't have to start pumping right away, just a couple of weeks before, maybe after the first morning feed, in the evening after baby goes to bed, or a time when you're feeling most full, just to start getting used to the pump. Also keep in mind that whatever you're pumping is excess. If you are exclusively nursing, then your baby is taking the majority of the milk out. The morning feed, or that first feeding of the day, is usually the feed where we have the most milk. So you may get an ounce or two after that feeding, but that should never be your expectation. The expectation isn't to, again, build your freezer stash, but more to practice using the pump. Most moms, on average, even when baby isn't exclusively nursing, only make about a half an ounce to an ounce of milk per breast per hour and can get that out with a pump. A baby is way more efficient at pulling out milk than a pump is. So it's also not a great indicator of how much your baby is taking or needs, because they are just more efficient at taking out milk. And then when you are separated from your baby, you want to make sure that you're pumping every 3-ish hours, 2 to 4, kind of 4 being your max. But sometimes meetings pop up and you're not able to pump as often as you would like. But at the beginning, it's important that you create some sort of consistent schedule around pumping to keep up your milk supply. You also want to make sure that you are still breastfeeding as much as possible and not just switching strictly to the pump unless you're wanting to move to exclusive pumping. Because again, baby at the breast is going to pull out more milk and maintain your milk supply much better than a pump is. So as you're preparing this milk, you're pumping out this milk to essentially give baby in a bottle. You want to make sure that baby is going to drink it. So when you're starting off with the introduction of the bottle, you also want to do this just a couple of weeks before you go back to work. And have somebody else feed the baby the bottle. Babies are really smart and they are not going to want to take milk from a bottle when mom is trying to give them the bottle. They're like, no, no, no. I know where the milk is and I want it straight from the tap. I don't want it from this. So try having somebody else feed the bottle. And sometimes you have to leave completely, like get out of the house in order for baby to take that bottle. It's also just time that you're practicing. So this isn't necessarily for baby to take an entire feeding. So do it at a time when your baby is most relaxed. They aren't super hungry. They're just kind of taking a little bit of a snack. They're just getting used to the bottle. And you only want to ever use a slow flow or stage 1 nipple. So don't kind of go up nipples to make it bigger, hoping that if you flood the baby's mouth with milk that they're going to just start drinking. You really want to make sure that you're keeping a slow flow or stage 1 nipple so that your baby has to work to get the milk out. If it's too easy, then they're going to completely stop breastfeeding because they think like, hey, you just put this bottle in my mouth, milk just comes out and I'm good. I go to sleep. And so we want them to continue to nurse. This is kind of the problem with me and my daughter with breastfeeding is that the bottle we had, which was a stage 1 nipple, was one of the fastest stage 1 nipples. And because of that, while we were waiting for her tongue tie revision to happen, she just got used to the bottle and refused to nurse after that. So don't let that happen to you. And then you want to make sure that you're pacing the feed, kind of letting baby take control over the feed. Hold baby in more of an upright position like you can see in this picture. And sometimes taking the bottle involves taking the bottle in a position that is so different from nursing, like this picture, because they know, right? They know if you put me in this position, the breast is there and I want to nurse. And so sticking them in a completely different position can help them accept the bottle more freely. And then respect baby when baby gets full. So clenched fists are a hungry baby. Empty fist or relaxed fist is a full baby. So watch for those fullness cues and stop the feeding, even if they're still drinking, when they are showing signs of being full. And so here are some of those supplies that I mentioned before that you may want to have on hand, like breastfeeding bags, bottles, a cooler to transport bottle labels, kind of whatever works best for your situation, your pumping and nursing needs, as well as your child care provider. And again, continuing to really feed directly at breast whenever you can, because that is going to be the best way to maintain your milk supply, as well as give baby all of the benefits of nursing. So the next thing is thinking about how much milk your baby will need when you're separated from your baby. So this is oftentimes one of the toughest decisions for families to think about in that transition is I have no idea how much my baby is taking because they're feeding directly off the breast. And knowing that pumping is not an indicator of how much my baby takes or how much I'm making, how much should I be sending and how often should my baby be eating? So breastfed babies eat anywhere between about an hour and a half to every 3 hours. Oftentimes babies who are bottle feeding a consistent amount every single feeding, which is different than nursing because they're snacking and having meals and taking different amounts at different times. So in childcare, when they're taking 3 ounces every 3 hours, they tend to create more of a consistent routine than they would when you're nursing at home. So know that once they do go off to school and they develop that more consistent routine, that does not necessarily mean that that's how you need to start nursing at home. You can still continue on demand feedings. So for most breastfed babies, they take about 25 ounces in 24 hours. So thinking about how many times is my baby nursing during the day, divide that by 25, and that'll be your rough estimate on how much to supply in those bottles. Always go on the low end than the high end. We can always warm up more milk or bring in more milk. We can't do much when it's all wasted. I would hate for you to waste milk by bringing in larger bottles and your baby's just not consistently eating them. So about the number of feeds divided by 25 will give you a good estimate. Again, babies take about 1 ounce an hour. So if they're eating every 3 hours, a 3-ounce bottle is a good place to start. I think for both of my babies, when they started care, my son started at 6 weeks and my daughter at 12. My son, I think I was sending 2.5-ounce bottles, and my daughter, I was sending 3-ounce bottles. So that can kind of give you an idea of how much they were eating at each bottle feeding. Breast milk changes in calories as your baby gets older. So at 1 month and 6 months, they're usually taking about the same volume of milk. The calories just have increased in that milk. So a 4-ounce bottle at 3 months, they're probably still taking a 4-ounce bottle at 6 months. And again, a breastfed baby is never going to take an 8-ounce bottle, so that should never be your expectation. So knowing that a breastfed baby and a formula-fed baby just look very differently when it comes to this. KellyMom.com is a fantastic resource for breastfeeding. She has a milk calculator on her website. So what you can do is put in the number of feedings that you do during the day, and it will give you a high end and a low end as far as milk goes. It'll give you a good range of what to expect when it comes to providing milk in bottles when you're separated from baby. And again, we want to make sure we're not wasting milk. I would hate for milk to get wasted because your baby is on day 2 of childcare and still getting used to what that looks like. So err on the side of smaller bottles and maybe bring in a couple bags of 1 or 2 ounces of milk. I love ice cube milk. So putting milk in an ice cube tray to make like little cubes. Each cube is roughly 1 ounce. So you can pop a couple of cubes in a bag and send that off, and then they can warm up just kind of 1 cube at a time if your baby does need a little bit more. But again, we want to make sure that they're not wasting milk. So go low versus high at the beginning. And so what do you do with that milk after you pump it? So there are definitely policies and procedures within childcare on how long milk is good for, but that is how long milk is good for in childcare. So any unused milk that is thawed should be sent home at the end of the day. And then frozen milk, again, in that freezer compartment is only good for 2 weeks, but in the deep freeze, it's good for about up to 12 months, if not longer. So just have them send milk home at the end of the day, bring new milk in the next day. And from that end of things, you don't really have to worry about things. But on your end of things, know that milk is good in the refrigerator for up to 5 days. If you're planning on freezing it at some point, just freeze it to start with. I wouldn't keep it in there for 5 days and then freeze it. It is good out at room temperature for 4 to 8 hours. The CDC guidelines are always going to be much more conservative than the actual guidelines when it comes to storing and caring for breast milk. So there is a range, right? For the most part, if it doesn't smell bad, it's not bad. When in doubt, use the milk. The one big thing is once it's thawed, it's really only good for 24 hours. So don't thaw milk unless you need it. Don't thaw milk and make 6 bottles to send off to childcare the next day. Make it that morning or send them in frozen. And then if you are pumping in the middle of the night, which is something that I was doing as a breastfeeding mom, that not every mom does, but I had breastfeeding problems, that milk is fine, again, at room temperature for between 4 and 8 hours. So pump, leave it on the counter, and go back to bed. Take care of it in the morning. Get your rest. And lastly, many states are Kellogg states, which means they're funded through Kellogg to have resources available for childcare programs around breastfeeding. Colorado is one of them, and they have a breastfeeding-friendly designation for childcare programs, and they also have an extensive toolkit for programs and families on what childcare and breastfeeding look like. So this is kind of the first place I would look to navigate any struggles or concerns that you might be having, because this is a fantastic resource and a resource that you can share with your childcare program as well. So it's just breastfeedcolorado.com. And then I have my email up on the screen. Feel free to email me if you have any concerns, but I also will stay on to navigate anything that you want to navigate one-on-one. But I hope that this eased some of your concerns around sending your baby off to childcare, or possibly answer some of those questions that you have on what can I do to make that transition smoother for myself and my baby. And again, it was a pleasure having you on today.